Just weeks away from some 20 million Americans seeing a major spike in their healthcare premiums. That's unless Congress works to extend the subsidies under the Affordable Care Act. Lawmakers expanded and boosted those tax credits during the pandemic, making coverage more affordable for millions of families. But if the subsidies expire at the end of the year, premiums would double for the average enrollee, and some people could see their monthly costs rise by more than $1,000. William Brangham joins us now with more. William?
Jeff, that's right. This battle over extending subsidies was at the very heart of the recent government shutdown, but Democrats were not successful in securing any deal, and now both parties remain deadlocked over this issue. The Congressional Budget Office estimates that more than 2 million will not be able to pay these higher premiums or other costs, and thus will drop their insurance. Here's what we heard from some people who are afraid of just that.
My name is Crystal Akers, and I live in Bowling Green, Kentucky. I got a notice October 1st that my premium as of November 1st would be going up over $500.
My name is Rashonda Young, and I live in Waterloo, Iowa. My premiums with the premium tax credit are $94 per month, and without that credit, they go to $592 a month.
My name is Tanika Mason, and I live in Dayton, Tennessee. My husband logged on to the marketplace the first day it was available and saw that our premiums are going to increase by $1,100. And that is actually devastating to us. The increase is about 225% from what we were paying previously.
I am Melissa Ruff. I'm in Jacksonville, Florida. If nothing happens with the subsidies being extended by December 31st, my premiums will go from $238 a month to $1,308 a month for my insurance, which is not even top of the line insurance.
The subsidies through the marketplace since the ACA went into effect have allowed me to have insurance as a single parent. Without that, it's unmanageable for my budget.
I had gotten a breast cancer diagnosis a little over a year ago. And so, having a good, reliable plan was incredibly helpful because even with a plan, you've got to pay your deductibles. So I still had to pay thousands of dollars out of pocket, but at least my monthly premiums were affordable.
Our daughter is a brain cancer survivor, and we have to go with the insurer that covers the specialist that she needs. My husband and myself also have health issues that require multiple visits with specialists throughout the year. So not having insurance is not an option for us. It would ruin us financially.
I found out in 2022 that I had heart disease. So it allowed me to have a cardiac cath at very minimal cost, and stress testing and echocardiograms and mammograms and GYN and everything else and all of my medications. So now without any health insurance, that's what I'm facing.
I think the ACA was a step in the right direction. My biggest problem with it is how unstable it's gotten. So it becomes impossible, I think, for the middle class to get ahead.
I would not have been able to get health care back prior to the ACA because of pre-existing conditions. So now the pre-existing condition thing with Obamacare, is that going to be cut too?
The frustrating thing for me is that you have members of Congress who have an incredible health insurance plan. They don't understand what it's like to have to decide between, health insurance and decreasing my food budget for the month.
I'm still in the process of figuring out what I'm going to do next. As far as I'm concerned right now, I don't have insurance. I turned off my payment for November, and I've just got to figure out my options.
I have chosen to go without insurance in 2026. I'm not going to be able to afford it.
It was such a surprise for me, to get a cancer diagnosis. And so just knowing that life happens and not having it is also not an option.
So extending these subsidies would cost an estimated $350 billion over the next decade. The president and a number of Republicans have suggested they would rather give that money to people directly rather than to insurance companies. So for a deeper dive on what we do now, we get two different views. Jonathan Cohn is senior writer at The Bulwark and author of The 10-Year War, Obamacare and the Unfinished Crusade for Universal Coverage. And Brian Blais is president of Paragon Health Institute. He served on the National Economic Council during the first Trump administration. He testified in front of Congress yesterday on rising healthcare costs. Gentlemen, welcome to you both. Jonathan Cohn, to you first. We just heard from several of people who are alarmed at the prospect of what might happen to their insurance if these subsidies are not extended. Given the deadline that we are up against, what do you think is the best course of action? What should we be doing now?
Well, if you're just talking short term, I think there's a pretty easy answer to that. Extend the subsidies for 1 year or for 2 years. There's a broader conversation to be had about how to fix the healthcare system, how to either improve or change the Affordable Care Act. This is a debate we've been having for 10 years. Democrats put forward, legislation at the beginning of this year to talk about that. People like us have been talking about this for months. The time to sort of do a bigger conversation was 6 months ago because it takes time to work these things out.
Brian Blais, you testified before Congress yesterday, arguing that the ACA and somehow the way these subsidies are structured is a principal driver of rising costs. The president, as I mentioned, has suggested funneling that money directly to individuals instead. What do you make of that idea? What do you think we ought to be doing now?
Yeah, and thanks for having me on. So there was bipartisan agreement at the hearing yesterday that the Affordable Care Act has failed to make health insurance affordable. It's led to coverage with significantly higher premiums, deductibles, and narrow networks. And one of the areas of confusion here is that the subsidies remain in place. For 94% of enrollees, they will maintain significant taxpayer assistance for coverage. That is not going away. What is at issue is a COVID-era policy that increased these subsidies that go directly to health insurance companies. And there are key structural problems with the ACA. And these subsidies that go directly to health insurance companies go to many enrollees that don't use healthcare services at all. So 35% of all enrollees in 2024 didn't use their plan a single time. Part of the problem is a surge of fraud that has entered the program with these enhanced subsidies. And so what is happening is taxpayers are sending a lot of money to insurers on behalf of people that don't get any medical care. And I think we need to address the core structural problems at the roots of the ACA that have led to a deterioration in the quality of health insurance. And continuing these inefficient subsidies will mean that we don't improve the quality of coverage in that program.
Jonathan Cohn, how do you respond to that? That's something that the way these subsidies are structured, they're going to people who may not necessarily seem to need them immediately. They're incredibly costly, and that perpetuating them only kicks the can down the road.
Okay, so, there's a lot to unpack there. Let's focus on this one question of the people who are getting subsidies and not using them for claims, because this has come up a lot. It is true. There's data from the government that 30%, or I think it's actually even a little higher now, of enrollees at the ACA don't file a claim during the year, and this is supposed to be evidence that you have people who are sort of misenrolled, fraudulently enrolled. Something to remember. I mean, the fact that you don't use insurance a year doesn't mean it's wasted. Especially younger, healthier people are going to go and have periods when they're not. When I was 27, I don't think I went to the doctor for like 3 years at one point. Then the fraud issue is real. There has been an uptick in fraud. But if you look at where the fraud is, and actually there's some really good research on this from Brian's research organization, Paragon. What they note is really concentrated in the states where they use the federal website, healthcare.gov. And there were a number of changes made to healthcare.gov that made it easier for brokers to enroll people directly. And everything that you look at what's going on, a lot of this is brokers behaving badly. That's terrible. We should do something about that. But, you can do something about that without taking away financial assistance from people. And the proof is that the states that didn't make those broker changes didn't see nearly the kind of broker fraud.
Brian, back to this issue of the deadline that we have approaching here. There is, both from a political perspective, with midterms looming, and Republicans don't want to be blamed for this sudden spike in premiums. Do you think that what the president and some Republicans have floated as far as, rather than extending the subsidies, but funneling the money to individuals, do you think that is workable? And do you think it is workable in the time frame allotted?
So let me clarify again that the subsidies remain in place, and 94% of enrollees will receive subsidies still. That means the government is paying a substantial share of their premium. So for the typical enrollee next year, the federal government's going to pay more than 80% of the subsidy. I think that there are proposals out there that can redirect a portion of the subsidies from the insurer to the patient. There's actually a policy that was put in the House-passed version of the reconciliation bill that would have lowered premiums by 12%. And what you could do is you could allow individuals to take a portion of that subsidy that currently goes to insurers to reduce plan deductibles and out-of-pocket limits. And you could give it to enrollees as an HSA contribution so that the enrollee controls the spending. I think fundamentally, the way that we reform our healthcare system and make it more affordable is to give more power to the patient and stop sending so much federal government directly to health insurance companies. That is not the way to make the system more efficient. It's the way to keep premiums and prices rising, because it gives insurers very bad incentives where their incentives are just to continue to inflate premiums and the prices that they pay for healthcare services.
Jonathan, last question to you. What about that idea? And will it get done in time, do you think, by the end of this year? And what might this do to the marketplace itself?
Yeah, so I think trying to put in place something like this in the next 6 weeks, we're 3 weeks into open enrollment. The next plan year begins in less than 2 months. Is ridiculous. Trying to set something up like this on short notice is not going to work. There are lots of reasons to be skeptical. There are versions of accounts that would work perfectly fine. And, I think we're just getting the legislative details now. And some of them would work out quite well for some people. But there's lots of reason to think it's not a magic bullet. We've got data on this. People are terrible at shopping for healthcare, and lots of reasons to fear that this will shift the burden of healthcare spending onto people with big medical expenses. And I think that gets to the basic divide here. Is your top priority to spend less money, believing maybe that will make the healthcare system more efficient and less government is better? That's a respectable point of view. Or is your top priority to make sure people get as much help as possible because healthcare is so expensive, even if that means spending more money, even if that means bigger government? And I think that's the choice we face here.
Honestly, my top priority is more affordable, accountable health system that improves Americans' health over time. And I think Obamacare has fundamental problems in it, and we can't just keep doing more of the same.
Is that funded by the health
industry? That's just going to lead to worse health care and worse health outcomes.
All right, Brian Blais, Jonathan Cohn, very important debate we are having here. Thank you so much, both of you, for being here.
Thank you.
Oh my gosh, $1 out of $5, 20%.